So it's just a couple of lines.
Yeah. Someone that does it for us.
Of course. You have it? Okay.
Yes.
Yeah.
And I mentioned.
Formal, not. Okay, good evening, everybody. This is the Fallbrook Regional Healthcare District Board of Directors meeting on February 12th. Calling the meeting to order. 6 p.m. Okay, we'll have a roll call, please.
Director Jeffries.
Here.
Director Canseco. Here. Director DeVito. Director Salmon.
Here.
Thank you. We have quorum.
Thank you. Please rise for the pledge.
I pledge allegiance
To the flag
of the United
States of America
and
and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, may I have a motion to approve the agenda?
So moved.
Second?
Director Jeffries.
Aye.
Director Canseco.
Aye.
Director DeVito.
Aye.
Director Salmon.
Aye.
Thank you.
Thank you very much. Moving to public comments. We have a card from Jessica Munoz, and she is here to talk about grant appreciation.
Good evening. My name is Jessica Munoz. I am the CEO at Voices for Children, and we're one of your grant recipients this year. And so I just wanted to use these couple minutes to say thank you. We are first-time recipients. Our mission is to provide CAPAs, court-appointed special advocates or trained volunteers to children who are experiencing foster care. And from the child's perspective, the benefit is a caring adult outside of the home that can get to know the child, really understand their individual needs. And from the system's perspective, it's having someone like that in the child's life who can then identify unmet needs or concerns that they might have that need to be addressed. And one of the things that we really train and equip our volunteers to do is to make sure that children are receiving access to primary care, specialty care, and behavioral health and developmental services when necessary. And so the district has really helped us to do that for children living in our community. We have served 11 children so far this year. We expect to serve about 18 within the district. I think our last report said 9, but that was a couple months ago. So we've had a couple more matches since then. But I just wanted to take this opportunity to let you all know that this investment has really made a difference. And we're so, so grateful for the opportunity to apply for these funds. So thank you for investing in the kids that we serve.
Thank you.
Thank you so much, Jessica. Just from a experiential aspect of foster youth for the schools, helping foster families and foster kids and parents of the kids who are foster kids is a big challenge, and any help we can get, we appreciate it. So thank you so much. Any other public comments?
Well, I was going to say, I was waiting for you.
Rachel's giving me the option. I'm Linda from Divine Path, and you guys have given us funds for the last few years, and we are so grateful. Students are thriving, but our latest curriculum is customer service, and they want to show their appreciation by creating simple case. Thank you guys so much. It's over for us. This is Tom, our board of directors.
Hi, Tom. Hi, Tom. Well, you know, I'm hearing more and more in the community. Divine Path has made its way into hearts and minds in our community over the years. And it really is a standout in people's view and perspective of things, and for the good work you do for another special population that needs structure, love, care, concern, and accountability. So we so appreciate that.
We had a group yesterday coming from the country of Estonia. Special education, special ed educators came out, so it was pretty fantastic.
Well, see, international, here we come.
Yes.
Thank you so much for
Thank you.
everything, and this is lovely. Okay, may I have a motion to approve the consent items?
We have actually a presentation first.
Like I said, we've got a presentation first. I went right to E. And Lisa Turner, you're here, I know, there you are. And we're gonna hear about the Palomar Family Counseling partnership that we have, and so glad to have you here with us.
Well, thank you so much for the invitation. I'm very happy to be here. I belong to Palomar Family Counseling Service. Hopefully many of you have heard of us. You've seen us around town. We've been here in Fallbrook since the 1960s, founded in Escondido in 1956. So we've been around a long time. If you don't know us, I'm only going to talk about the whole organization for just a brief moment. Just so you know, we are a nonprofit. Clearly, we are mental health primarily. There's such a place out there for so many organizations to do all kinds of social services, and they're all important, but we really stay very, very focused on mental health. We really believe that if mental health issues are left untreated, it can often have very dire consequences for the individuals, of course, their family members, their neighbors, and communities. And so it's really, really important that there's organizations like ours out there to address these needs, and we're thrilled to be doing it. We've been doing it for a long time in Fallbrook, and we've served a lot of the Fallbrook area population. One thing, though, that we were really excited about when Rachel and I started talking a few years ago about utilizing space at the Wellness Center was to be able to maybe even reach more people or a more diverse group of people than what we were meeting before. So as a nonprofit, we tend to serve the underserved. So the primary focus of our day-to-day services are those who have very few resources. And that's really important, and that's the key thing what we do, and that's the vast majority of the people that we see. But here in Fallbrook, it's been really nice to be able to be at the Wellness Center and to be able to see a variety of people who walk through the door. Some people who maybe have more means, but maybe didn't always have ready access to mental health care, or who are just thrilled to have easy access, in short transportation or whatever to get there. So it's been really nice to be able to serve a little more diverse population that way. We've really enjoyed that. We've also really enjoyed working with a lot of older adults, which we do in our organization, but really it's just a small percentage. Our organization is very heavily focused on youth, not entirely youth. We do serve individuals of all ages, couples and families, but I think the last stat I saw was we were like 78% youth serving. And that's because we're in so many schools. So we do a lot of school-based services all over North County, Oceanside, Vista, San Marcos, Escondido, Fallbrook, and Valley Center. So anyway, we have loved to have been here at the Wellness Center. So there's a couple of slides to show you. So the photo on the left, if you see, that's one of our therapists, Gwen Evans. Some of you may have met her. She is up at the Wellness Center, I think, 3 days a week. She's there with Jasmine, of course. You can see the other photo is the office. So that's one of the two offices. We love our office space there. It's so great. The therapists who work there, they never want to come back to Escondido. They're like, nope, this is my new home. We do have a very cute little office here on Hawthorne where we've been for a very long time, but our Hawthorne office is quite small. So it's been really, really nice to have this extra space and to be a little bit on this side of town as well. So you can see that's the office that Gwen uses most of the time, and the other photo, of course, is just from the grand opening thing that we did about a year ago or so. You can go to the next slide. So this is just a little bit of, so since we began contracting with the health district, which began in October 2023, you can see that we have served exactly 100, which is just a crazy coincidence, but exactly 100 people to date. 10% of those are Spanish speaking only, which is a much smaller percentage than most of the clients that we serve out of our Fallbrook office. Exact split between male and female. You can see the age, there's all age groups are pretty well represented here. So here through the Wellness Center, only about 27% of the clients that we're seeing are kids. So that's a very different from our organization as a whole and very different actually from our operations of our Fallbrook office on Hawthorne. So you can see all ages are there and it's about 20% are 65 or older. We're really excited about that. Primarily what we've done for those 100 individuals, I think it says 64% received individual counseling for themselves, 21%, if I'm reading that right, is couples counseling, and the remainder of 15% is family counseling. Next slide, please. So one thing that we've done, your funds or the partnership, the contract that we have allows to help subsidize us so that we can continue to see people who need to be seen on a sliding scale, or who don't have insurance or have a type of insurance we don't accept. And so you can see about 74% of the people that we've seen are on that sliding scale. 13% don't pay anything at all, which is because that's what they are able to afford, and it's very much part of our mission to make sure that everybody gets access to care if they need care. And then we're about 14% have insurance so far. So part of that, why that number maybe is a little bit low, we hope to see that go up in the next year, is we decided about a year ago or so that we really wanted to, part of our strategic plan was to embark upon some more insurance providers or third-party payers. We didn't realize, or I was a bit naive, I think, about how complicated that process was going to be, how much time it was going to take. We've come a long way in a year, but we're still getting those. You can see by this point, we have one of our therapists who's at the wellness center. I believe she was there on Mondays. Not sure if she went back after the whole construction piece, or if she's still involved, whatever. Raylyn, she's credentialed with all of those that are showing there. TRICARE and TriWest has been really a bonus for us because obviously this is a heavy military community, not just active duty, but also retired. So having several therapists now who are on that panel has really helped us to meet the needs of that population. So, like I said, we're just still thrilled to be there. The financial support of Fallbrook Regional Health District allows us to offer low and no cost for those who are most in need, helping to ensure that mental health support is available to all members of the communities, regardless of their financial situation. Next slide. This is just, the therapists put this together. They track all of the people that are seen, and then they track the presenting problem. So this is just to kind of give you an idea of the reasons that people are citing for coming in for service, and they are a wide range. I won't read them out, but you can see for yourself as a wide range. They're all important. They all need care. We currently, through this contract, I believe we have staff at the wellness center six days a week. It's really 5, but there's some overlap there. So I think it's 6 full days a week is what we have, and we're there late on Tuesdays so that we can see individuals and families up until 7 o'clock. And I think that's maybe the last slide. Is there one more? I'm forgetting.
That's it.
Yep. If you have any questions, I'm happy to answer, but thank you so much for the opportunity to contract to provide these services, and we're thrilled to do it. And I thank you very much for your time.
We're glad you're here.
Thanks.
Do any board members have questions they'd like to ask? If I may, we had a grandparents raising grandkids component to our work. Is that still a heartbeat?
I think it's still a heartbeat. It's not in a formal sense. I know that the staff member who's involved, Graciela Moreno, you probably have known from different collaboration meetings. I know she still keeps in contact with many of those grandparents. So she's doing it sort of very informally, helping to connect them to different resources, and some of them do keep in touch, but in a formal sense.
Okay. And how many referrals do you get from the schools?
That's a good question. Our full service partnership program is what takes the most referrals directly from the school. And that program is in every school in Fallbrook. That's the program though that serves fairly high needs kids who have Medi-Cal. Yeah. So it does not serve students who don't have that but Fallbrook has really beefed up their own internal structure. They have more social workers, they have more school counselors themselves, so they're able to provide a lot more of the service in-house. Through our, oh my gosh, I'm completely drawing a blank.
For the,
Mental health matters, I'm sorry.
oh yeah,
My
the
brain just
grant,
stopped.
the grant name
Through the
would
mental
change.
health, yeah, through the mental health matters piece, I know that we serve, like we go to Boys and Girls Club and serve the after school program there. So that's an easy way of getting a lot of the kids who go to the central club.
Well, thank you so much. I feel like we have a trifecta tonight that really, as a board member, makes me so happy. And we've got the foster youth, we've got the adult and yet need more guidance and help. And then we've got this widespread counseling effort. And I just can go to sleep tonight and be happy. And it's just great to see how things are blossoming and intersecting with each other. So thank you, and thank all of you for sharing. Beautiful. Okay, now I think we're on E. Okay, may I have a motion to approve the consent items? Move. Thank you, Sally.
Second.
Thank you, Howard. It's been moved and seconded. Roll call.
Director Salmon,
Aye.
Director DeVito. Director Canseco.
Aye.
Director Jeffries.
Aye.
Thank you.
Mhm. Well, speaking of grant making, this is our meeting where, as a team, we're going to review the scoring rubric for the expected avalanche of requests for grants for the ensuing year. So I will turn it over to you.
Thank you. So this evaluation form will be familiar to Jennifer, to Howard, and to Bill, but obviously this will be the first time for both of you to go through the grant process. To our grantees, you get to see behind the curtain. This is what they do. The application process is pretty straightforward. The scoring is the more difficult challenge, right? Because you're comparing an apple and an orange and a pineapple and an avocado on the same form, which is a difficult thing to do. So early on, when we were formatting this a few years ago now, to try and standardize it as much as possible, we've moved things to Likert scales. Most things are 1 to 5. What's different in this year's scoring is that there have been, over the last couple of years, more priority and emphasis on certain components of the grant. So we've weighted, to some extent, the scoring on those. And that really has to do with the impact that the grant can make in the community, either through the width, right? You're serving a broad number of people, or the depth, how deeply you're serving that population. That's a difficult thing to encompass. So what we've really done through this is to make sure that the grant application is being very clear in what the statement of need is, the case, the reason that they're doing this service, the how they're providing the service, and then the impact that they're making through that service. That will be where you're going to have the tough job of scoring it. So one of the things we want to definitely kind of come back to is this idea of inter-rater reliability, where you have 5 individuals reading potentially 30 applications, but you're using a similar methodology. So the idea is your mid-score, whether it's a 1 to 10 or 1 to 5, which is 3 to 5, right? Your mid-score is they just met, everything is fine, it's standard, but there's nothing exceptional and there's nothing in a deficit, right? So a 3 or 5 is just, it's fine. It's good, they've met the answer. 6, 7, 8, 9, 10, 4, 5, whatever that is, you really want to be able to make notes on why that is exceptional. And if it's under or below, again, what was lacking or what did you need more information in order to see more? You're going to be able to put those notes onto your scoring sheet as well. And we'll recommend that during the time that you're evaluating these grants, you're making those notes. What will happen is after you've done your scoring, you'll provide those score sheets to Raquel and I. We will then take those scores, make it cumulative, we'll blind it. You'll be given the averages, right? So that you'll know among your cohort here who's kind of scored, but you won't know whose score went to what. So you're blinded there. And the idea is that you've got as much objectivity as possible, right? So when you're looking at doing your scoring, you have to score it based on the information that is provided in the grant application. So only. So while we love our grantees, if their application is lacking and doesn't answer the question, your scoring needs to reflect it. If they have done an exceptional job pointing out how their impact is long-term or deep or whatever that is, again, that's where you're going to consider giving more in scoring. But your initial medium score kind of starts in, right? That's the philosophy we started. Did I get that captured
Yes.
correctly?
Yes,
Okay.
we start with a 3 or a 5 and then justify lower or higher. And that way we all start in the same lane and then we explain our variance.
Right.
Mhm.
So we've had a few different questions that we've changed. Jennifer and I worked pretty good to make sure that they are, again, clear and easy to understand. So what will happen, the grant window is open now. It's open till the end of February. So the applicants can apply online at the end of February. Raquel and I will download those applications as well as all the attachments, their 990s and all the required documents. Then Raquel and I will go through them to make sure they're compliant. Did somebody miss a page? Did something get corrupted? Make sure that it's all in there. We'll put together a binder for each of you that has each grant application. They're numbered. We ask you to keep them in order so that when you get back together and I'll discuss it, grant number 3 is the same for all of you, right? Then at the April meeting, we'll give you this binder typically at the March meeting. You'll have until just about the first couple days of April to get them scored and then get them back to the score sheets back to us. You'll keep your binder with your grants and your notes. At the April board meeting, Raquel and I have done our job. We'll have provided you, the board members, with these aggregated scores, the average score, and I'll separate them into typically the top third, middle third, and bottom third on their scores. It will be up to you at the April meeting to discuss in open what you loved, what you were or where you found things that were lacking, right? So it really depends. Each chair has done it a little bit differently, but I'm going to venture to guess, since Jennifer and I have kind of done this before, usually your top third, you've all already agreed on it. So a lot of times you might just say, okay, we're going to agree to fund this top whatever percentage number. We're going to discuss the middle category because that's where the horse trading is going to happen. Not true horse trading. But that's where you're going to have this discussion of where you saw something that maybe one of your cohort did not. And then usually the bottom third, there's already some substantial deficit in that application, whether they don't meet our guidelines, the mission doesn't align, whatever that may be. But that will be the April meeting. Typically, we will hold that out at the Health and Wellness Center because this room is too small to hold all the grantees who typically come to that meeting. So usually at the end of the April meeting, you'll have already decided who you will be funding, which is great because then I can finalize it in the budget. So that when we start in July, which is when we make the first payment to them, everybody knows exactly what's happening and when. Is that process clear? Does that make sense for you guys?
Yeah. The ad that I'll make, and Howard, please chime in. 2 things. Part of our job is not only to fund, but say how much. And the applicants will request a certain amount. There is conversation among us where we say, probably not that amount I'm comfortable with, but I'm comfortable with this. And then we look for a consensus around that. So the other is I want to make sure you all, on your meeting, when you say how many meetings you have gone to for the month, make sure to add 2 meetings for the scoring time that you put into the grant review. Okay. Howard, any tips?
No, I think both of you did it, just like I remembered it.
Well, once a year. We get it right.
And as you're going through the process, from the March, the first part of April, if you have a question about the grant application, you don't understand a piece of it, or there's something about it, direct your questions to typically myself or Raquel, and we'll explain from a technical standpoint. It is not our job to rally for any one entities. No offense, we love you all. But the idea is to give you the technical information. So perhaps you want to look at their 990 and statement of functional expenses, and I'm going to geek out, so I won't do that. But imagine you have a question on a technique or something. Typically what will happen is we'll take that question. If it's something that was within the application we can answer, we'll provide that back to you. Send that information to the board so that everybody has the same info. If it is something where we need to go to the grantee for clarification because something got left out a page, then we'll do that same process. But otherwise, it's generally just going to be what you got in the packet is what you're going to get. Right? Does that cover everything as well?
Very good, very good. Right. All right. So any proposals that didn't meet the complete guidelines that we've set forth will just not even be.
Typically, we won't even put them into the packet if they don't qualify. So if they aren't a 501c3, there's very few things that'll exclude. One of our exclusions are you must provide at least 80% of your clientele are Fallbrook, Rainbow, Bonsall, Duluth, residents. Thank you. So that if, 90% of your residents or your participants come out of Vista, well, that's not within our service. So we would go back to that entity and say, you don't really technically qualify. Other than that, we don't disqualify anyone. That is going to be up to you and your scoring. If they don't submit all the required documents, again, that's a potential for disqualification, but we do our best not to provide any value thinking or judgment on that. That's up to the board.
Okay. Five heads are better than one on this. 5 hearts are better than one on this. Okay, great. Thank you so much. Moving on to item G.
Quick minute.
Board member comments and items for subsequent meetings. You'll see on the agenda a list of our regular scheduled committee meetings. Might I ask you to introduce our new legal counsel?
Absolutely. I'm very proud and excited to introduce Alex Gidrogosian, who is our new legal counsel. I got the name right?
It was pretty close.
Say it for us.
Did you say it?
Giragosian.
Giragosian.
It's interesting
You rolled the R.
that Teresa and he are sitting next to each other, both with last names that are always screwed up.
Luckily, both are gracious.
Right.
So Alex and his firm actually come with a great deal of experience with health districts regarding Camarillo Health District, who we always want to grow up and be. It's my girl. Also, lots of experience with different municipalities, San Diego LAFCO. Anything else you want to introduce on your own, so I don't have to speak for you?
Sure. So I'm based out of the city of Pasadena. Our firm represents a lot of local government agencies. Me personally, my clients are the city of Sierra Madre, which is the one that was on the news that was burning.
Yeah.
So we're currently dealing with the debris flows. We're trying to prevent the debris flows. So city of Sierra Madre, Camarillo Healthcare District, Montecito Sanitary District are the 3 other government agencies I represent. For LAFCO, I'm deputy general counsel, so I'm not the general counsel, which is why I could take this job, because we could. There has to be a separation between my LAFCO work and the work I do for this district. But yeah, I've never really been to northern San Diego County. This is new for me. So I was driving around your neighborhood and it's lovely. I'm still looking for the avocado groves, but I was told I gotta go further south. East south, yeah. I'll find them.
Well, we welcome you to the team, and just for the public, we reviewed two firms, and you really stood out, not only in terms of your background and your firm background in HR, as well as health district-y stuff, you know, that you're kind of a one-stop shop for us. And you've got a deep bench should we need that. And so we're very pleased that we made this new partnership. So welcome aboard.
Thank you so much.
You're welcome. Okay. Let's you and I talk about that. Okay. Comments from board members?
I see that Vi Dupree is here, and Vi had served the district well and for many years, so nice to see you again.
Nice to see you as well.
Thanks.
Hi, bye.
She snuck in.
I saw that with that saucy hat on. Yeah. Okay, well, here we go. We will adjourn the meeting and begin our work on our responsibilities on the grant making. Thank you to the public for attending. Adjourn.
Yeah.
Sorry.
Oh, wasn't sure.
Yeah.
Kind of talk about it.